We are glad you could join us today for the ECG Webcast 2023 Pediatric Subspecialty Physician and APP Compensation Survey Key Findings, Compensation, Production, and Benefit Trends. I am Alan Lassiter, a principal at ECG with a background in pediatric strategy, provider alignment, and compensation design. I am pleased to be your moderator for today's program. In this webcast, ECG's team of experts will review findings of ECG's 17th Annual Pediatric Subspecialty Physician and APP Compensation Survey, as well as provide guidance on preparing for 2024. The session will include our analysis of important physician and advanced practice provider performance trends from the 2023 survey, and will provide recommendations from our experts on what organizations should implement now and in 2024 to address the 2024 Medicare Physician Fee Schedule updates and recent regulatory changes. We will also address the unique challenges faced by children's hospitals and strategies being employed to mitigate operational and financial issues impacting pediatric organizations. Before we begin the formal program, let's go over a few details about the webinar. Today's program will be 60 minutes in length, which will include 45 minutes of presentation and 10 minutes for questions and answers. Everyone should have received a copy of the session handout, but if you are a late registrant, you can download the handout in the handout pane in your screen. Attendees are participating in listen-only mode, but if you have questions, you can type them into the questions pane on your screen at any time. We will address them at the end of the formal presentation. If we are unable to answer all the questions today, we will follow up with you after the session. We will be launching an audience polling question today and hope that you will participate in the interactive measurement tool. And finally, upon exiting today's program, you will be directed to an electronic survey. Your feedback is important to us, so please take a minute to complete this survey. For each completed survey, ECG will make a $5 donation to Doctors Without Borders. Now, let's meet today's speakers. Stuart McClure is a healthcare administration professional with experience in practice management, physician compensation, and physician-hospital relationships. As health organizations navigate a complex regulatory and competitive environment, Stuart's clients value his expertise in service line planning, compensation plan development, and physician-hospital contracting negotiations. Most recently, Stuart's focus has been helping hospitals and health systems foster these strong partnerships with community and employed physicians by ensuring that compensation plans and service contract terms are appropriately aligned with organizational goals. Before joining ECG, Stuart worked at UT Le Bonheur Pediatric Specialist, also known as ULPS, a joint venture position between University of Tennessee Health Science Center and Methodist Le Bonheur Healthcare. Acting as the interim director of finance, Stuart helped guide ULPS's expansion initiatives, ultimately helping the practice grow from 100 providers across 15 specialties to over 160 providers across 23 specialties. Welcome, Stuart.
Thanks, Alan. Happy to be here.
Also speaking today is Angie Collins. Angie is responsible for conducting and expanding ECG's Pediatric Subspecialty Physician Compensation Survey. She is also integral to the conduct of the Physician Compensation Survey and other proprietary research efforts of our firm. Angie's expertise has been instrumental in expanding ECG surveys, which are now recognized as the most comprehensive source of provider performance benchmarks in the market. Her work informs analyses on key client efforts, including physician compensation plan redesign and market assessments, physician productivity evaluation and benchmarking, fair market value assessments and opinions, recruiting and retention benchmarking, and provider benefit assessments and design. Previously, Angie was a director in the Performance Improvement Department of Centera Healthcare, where she evaluated and implemented system-wide improvement initiatives that resulted in increased productivity, decreased costs, and improved operations. She also worked as a physician practice administrator for Emerson Hospital in Concord, Massachusetts. Welcome, Angie.
Good morning and afternoon, everyone. Thank you.
So before we launch into our presentation, let's just talk briefly about our agenda, which you see displayed on your screen. We will give a brief overview about ECG. We will then talk about the pediatric compensation-related market trends. We will do a deep dive into 2023 Pediatric Subspecialty Physician and APP Compensation Survey key findings. And then we will give you a brief overview of the ECG survey member benefits. And now I will turn it over to Stuart to give a brief introduction about ECG and to begin our conversation.
Thanks, Alan. So we'll just kick things off here on slide 6. A lot of you, I think, know ECG and are very familiar, but for those of you who don't, we are the nation's leading healthcare consulting firm. We've been around since 1973. Angie will address how long the surveys have been around, but it's been a core service offering of ours, particularly in pediatrics, which is a really important part of the firm's history. Moving on to the next slide, our sort of legacy core competencies are strategy, finance, operations, and technology, and you can see the sort of different business areas that translates into on this slide here. So starting at the left, going in counterclockwise with our academic healthcare group, doing a lot of work in that space. As we all know, pediatrics tends to be very academic dense. So there's a nice marriage between our academic division and all of the other work that we do at the firm, including that around pediatrics. We do a full suite of services within that world, as well as non-academics. And that sort of breaks down on the rest of this wheel as we work our way around it. So performance transformation, doing acute care, performance improvement, ambulatory related work, consumer engagement, digital health. That's where a lot of the IT related work tends to occur within that performance transformation category. Provider financial services, that's sort of the core group that this webinar stems from, is the work that we do around the survey. And all of the work that survey data really supports within compensation services, valuation services, and then the various analytical tools that we build for our clients. Strategy and business advisory is a big component of the work that ECG still takes part in at enterprise level, service line level, and even practice level. A lot of that work is created in the world of physician and hospital relationships, and ECG plays a big role and gets really excited about supporting kind of mutually beneficial outcomes for those strategic initiatives of consolidation, expansion, what have you, that an organization is navigating. And then, of course, the last component is our involvement direct to payer and on behalf of health system regarding payers, and that's our managed care services, and including value-based and working directly with or across the table from the insurance providers. Moving on to the next slide, we'll just leave this up for a second. These are just a few logos of the folks that we've had the pleasure of working with over the last several years. There are obviously a ton of logos missing from this. We can't include everybody, but just a brief reminder of sort of who this survey data is when Angie gets into that toward the back half of this presentation. It really is from a nice cross section of the country that not only includes a wide breadth of organizations, but also some of the preeminent organizations in the benchmark. So we feel really good about our sample and how it's evolved. Now let's jump into our comp-related market trends. So starting on slide 10, we're going to start at sort of a very narrow focus on something that is anecdotally recent in the type of work that we're experiencing and a lot of the work that I'm personally involved in now. And then we'll gradually blow out to some more large, broad trends in the space. So starting here, you can see on hospital-based specialty compensation, we've drawn a box around these three sort of typical constructions of comp plans, where on the left you have a fixed component with a variable component on top of it that is not necessarily time or work RVUs, but perhaps something more quality driven. And then in the next one over, you see the coverage specialties, where that incremental pay is often time-based or quality-based specifically. And then the more hybrid specialties is the third one, or the hybrid version of the model, where there is a production incentive, is the last one that we've drawn a box around. This is where I think a lot of hospital-based specialties are migrating toward. There's been an increased pressure on inpatient census that is, and the combination of that with, in a lot of markets, some shortages of physicians. There's been a lot of pressure on work-life balance, appropriate recognition of time spent in the hospital, not just the work RVUs being generated while there. And so what we've seen a lot of work in recently is sort of recalibrating compensation design for hospital-based specialties, such that the organization is properly incentivizing presence rather than volume. And we've found that tends to be a little bit more of a satisfier, particularly in organizations where there's a dedicated cohort of evening specialists in the hospital, and appropriately recognizing everybody's value across the whole care team. Moving on to the next slide is a little bit, we're kind of zooming out just a little bit into what some of the driving forces are behind the need for some of those compensation changes, and that's that we're seeing a little bit of a change in how the CFT is being defined in hospital-based specialties. In a lot of cases, I think we're seeing the limits to how few patient-facing hours there can be in a 1.0 CFT, and that's putting obviously pressure on the compensation model and maintaining control over sort of, you know, your expenses related to these physician groups. We do recommend that CFT expectations be aligned across facilities and to the extent possible, and across specialties within a single organization when they're sort of the same provider type. Now, moving on the next slide, you can see some of the effects of these changes and what we're seeing in the benchmarks, and that's that production on a per FTE basis has gone down a little bit. Compensation has gone up a little bit, and this is putting some added pressure on that push-pull of decreasing work expectations, increasing desire in the market for equity of a compensation model, which would be one of those models that a certain number of shifts is required, and shifts in excess of that number are paid incrementally. What we're seeing is the conversation is trying to push that number of baseline shifts down while maintaining the base compensation figure that's attached to it. And that's obviously putting some real pressure on the economics of some of these groups. And so making sure that work RVU incentives, if they're appropriate, are in there in the right way and incentivizing the right behavior is something that's become very important over the last several years, particularly coming out of the COVID pandemic and all of our new normal that we exist in now. Moving on to slide 13, continuing to zoom out a little bit away, now getting away, I think, from just hospital-based specialties. This is more about the reduced access to care generally in pediatrics, but it's really a nod toward the trends that we've been talking about at this webinar for the last several years. In fact, the first one that I can remember, we were talking about the concept of big tent strategy in healthcare, where organizations are really going out and attracting these tent pole specialist, if you will, where you can build programs, not just a specialty or a service line around that provider, but attracting certain providers. I think we all know what specialties they tend to be in. Cardiac surgery is one, where you can really build a lot of programs around it because of its existence and its prestige. And that is sort of playing out in this conversation around the reduced access to pediatric care in some geographies, where as a result of this consolidation driven by the big tent strategy, there's also the fact that patients, when they need to travel, are traveling farther to receive that care. Now, one trend that we did not include this year that is also sort of related to this is that telemedicine continues to be plateaued at about a 5% of claims generated rate across the country. If you'll remember from past webinars, it peaked at a pretty high level during the pandemic after being at near zero, and then it's sort of leveled out at 5%. We're actually hearing anecdotally from a lot of our clients that the improved access to telemedicine is mitigating much of this challenge from a travel standpoint for the physicians. And not only that, but it's improving some of the clinic access metrics around no-show rates and late cancellations, because parents are no longer having to take an entire day off work to drive 3 hours to the tertiary or quaternary center in the region to receive that care for their child. They're able to do it from home, take an at-home day, work from home day, whatever it is. A lot of us are able to do that more now, and I think that's playing out as part of this narrative. On to the next slide, we're showing a little bit of information here around the pediatric subspecialist training and supply line, where we are seeing that the total pediatric subspecialty resident graduates is increasing at a similar rate to the adult counterpart, so there doesn't appear to be any material discrepancies there. But we are seeing that there is an unfavorable trend relative to between pediatrics relative to adult in a few different specialties, and those that jumped out were pediatric endocrinology, child and adolescent psychiatry, which that one is probably a little more concerning given the trends that we're seeing in behavioral health and a lot of the hospital census related challenges that are being presented by the mental health crisis right now. So lagging behind in graduates on child and adolescent psychiatry and is a little bit of an added concern in our opinion, looking at this data. Pediatric pulmonology is the other one that jumped out as a notable discrepancy relative to adult. Now, moving on to the last couple of slides, last few slides in this lineup of trends before we turn it over to Angie. This dovetails nicely off of the behavioral health challenge that we've talked about in years before and is still a very real challenge that organizations are facing today. And what we're looking at here is on the left side, we have the reported, this is by the AMA, the reported responsibility for mental health care across various subspecialties. You can see there's a reported responsibility that seems fairly equitable across a lot of different specialties, where they're taking, even though adolescent medicine is at the top for a good reason, there are a lot of other specialties that are participating in mental health care services, and the reported competence on the right is the illustration of what challenge that presents. And so while it's not in the presentation this year, we've talked about it in years past, there is a passive way to approach mental health in your organization and an active way to approach mental health in your organization. And a lot of it boils down to getting the right specialists and individuals involved on both the clinical and administrative teams to build the appropriate ecosystem of healthcare and continuum of care for that patient population. Now, moving on to the next slide, slide 16, we are seeing that it relatively low change, but the percentage of pediatric lives covered by public insurance actually decreased by almost 1% from 2021 to 2022. And those covered by private insurance decreased also by 0.2%. So this is obviously increasing the prevalence of uninsured patients, which is complicating the economics, particularly in pediatrics, where we know most organizations are nonprofit, academic aligned, and mission based, such that charity care is a very real and regular part of the business. And this very slight increase in uninsured patients is putting a little bit of additional pressure on that equation, in addition to some of those trends that we talked about already, where in hospital-based services, for example, compensation is going up while work RVUs are going down. And then there's a collections part of that story as well that I'm sure Angie will be mentioning during her part of the presentation. Now, moving on to, I believe this is the last slide in the lineup before I turn it over to Angie, this is kind of the highest level view of pediatric healthcare that I like to look at, and that's what the U.S. birth rate trend looks like, because that is an indicator, as we all know, of what the demand for service is going to be. So as we think about the consolidation, the continued consolidation into regional, quaternary, and tertiary medical centers, combined with the push-pull of work-life balance and the desire for physicians to make just as much today as they did yesterday and potentially work a little bit less, and then the general provider shortages that we tend to see in both pediatrics and adult, is really all of those forces together are continuing to challenge pediatric healthcare in some pretty unique ways when you think about how systems are expanding and what they're preparing for in their strategic plans going forward. So with that, I will turn it now over to Angie to talk in more detail about the 2023 survey.
Thank you so much, Stuart. Moving on to slide 19, I'm going to spend a little bit of time just covering our surveys, and ECG's provider surveys fall within our provider financial services division and truly are a core service offering of ECG to both external clients as well as our internal consulting staff. And we do have that unique ability to marry our data analytic capabilities with our consulting expertise to produce market-leading, meaningful data and benchmarks that are in demand in the provider market. Our physician, APP, faculty, and pediatric subspecialty compensation and production surveys are the most long-standing annual surveys at ECG, and we do remain the only firm dedicated to producing annually a standalone pediatric subspecialty benchmark data set and reports for this unique pediatric market. And we know this data is truly critical and integral in terms of being a source of information to help inform strategic, operational, and financial decisions within our pediatric healthcare partner organizations. Before we get started with the key findings from this year's pediatric survey, I also want to touch on another of our core service offerings, and that is our CPT code profile tool. The ECG survey does collect annual CPT code data by provider. We then calculate RVUs for providers, all providers in our survey. And in addition to being able to produce RVUs under any year of the physician fee schedule, which we will talk about that later, our methodology also ensures that these important metrics are calculated the same across all providers, which significantly reduces the noise you encounter when RVU data is self-reported. Having these CPTs in raw form also allows us to transform the data into meaningful profiling tools, such as providing a specialty profile of services and procedures performed. We can also tell you the top CPT codes billed and compare your individual physician's distribution of, for example, E&M codes to the market. The capabilities are very powerful, and this tool is available for free to all of our survey members who submit their CPT data to us in the submission process each year. Moving on to slide 20. Now, really focusing on our pediatric survey, we continue to experience significant growth year over year. Since 2008, our data set has grown on average about 15% each year. In addition to capturing pediatric physician data, we also collect pediatric APP data, and that APP data is submitted to us at the specialty level as well. We have a consistent base of members year over year, with about 75 to 80% of the prior year organizations returning to the next year's survey to continue to propel the survey sample size forward. And through COVID, as well as significant regulatory and government changes, we have experienced the largest growth in the history of the pediatric survey in the past 3 years. And you can see that in the graph, which I truly believe points to the thirst for data in the market and a desire to partner with a firm who truly understands pediatric healthcare. In 2023, we reported data from nearly 19,000 pediatric physicians and APPs from 185 organizations. That's truly incredible. Throughout the remainder of today's session, as I'm reviewing findings, I will reference ECG Vault several times. And ECG Vault is our proprietary data warehouse tool that all organizations who contribute data to our surveys have a login for. ECG Vault stores valuable data in static files, such as the survey benchmarks for physicians and APPs. Those are delivered in an Excel format for all members for free. We have survey member lists published in Vault. This presentation with the slide deck will be in Vault. All of our reports, all of that's available to our membership base for free. In order to gain access to the dynamic reporting capabilities on Vault, your organization does need a full subscription, which carries a nominal annual fee, which is as low as $2,800 per year for an unlimited number of users. If you do need help locating your login to Vault, please don't hesitate to reach out after the presentation today. Moving along to cover some key survey demographics on the next slide. So this slide, as well as the next slide or two, will present an overview and highlights of our survey demographics. On the left of this slide, you will see the location of our 2023 pediatric providers by region. We group the states into regions on a macro basis, really. And this year, the data set from which we generated our benchmarks represents a fairly balanced pediatric population. 34% of our providers were residing in the West, 27% in the Midwest, 20% in the East, and 19% in the South. Nearly 19,000 providers are divided up by specialty category in the pie chart on the right. And the largest proportion of our providers continues to be physicians in our medical specialties, which make up 29% of our data set, and 32 medical specialties. 25% are hospital-based physicians reporting in 12 specialties. 22% are physicians in primary care, which is majorly general pediatrics. In this grouping, we also include physicians practicing as internal medicine pediatrics physicians as well. And then finally, we have the 5% are surgeons in 9 different surgical specialties. And then that remaining slice of 18% that you're seeing there are providers or non-physician providers, APP. So this would include your nurse practitioners, your physician assistants, psychologists, pediatric optometrists, etc. And again, these are all pediatric providers. And as a result, we have benchmarks for 55 pediatric physician specialties and 10 types of pediatric APPs in the 2023 dataset. The other thing I want to mention about our pediatric survey is around emerging and hard to find specialties. We have the unique ability through the CPT data and other publicly available data sources to deep dive into larger departments and specialties and break out those physicians doing specialized work. And oftentimes we are successful in locating a sample size that meets the requirements to publish data in that emerging and or hard to find specialty. Examples would be that we have published data in pediatric adolescent gynecology, bone marrow transplant, epileptology, pediatric dentistry, interventional, a lot of the interventional specialties, so interventional pulmonology, interventional gastroenterology, and so on. So if you are struggling with finding benchmarks for your physicians that really meet your needs because it's a unique or maybe emerging specialty, please reach out to us, and I'm confident that we can add value and find something that's going to be a good fit for you. Slide 22 provides a nice overview of some key survey member demographics related to group ownership, teaching status, the number of physicians within the group, as well as the type of children's hospital affiliation. ECG survey is well suited for those physicians and pediatric physicians in groups that are owned by a health system, hospital, some type of a university-based model or a foundation. 96% of our physicians are coming from those types of organizations, and that data is presented in the top right bar chart. The remaining 4% are from the independent multi-specialty groups primarily. In the bottom right, you can see that more than 2/3 of our physicians are affiliated with or employed within academic settings, and the non-academic groups would comprise about 32% of those physicians. In the top left, you see that 70% of the physicians in our data set are practicing primarily within a freestanding children's hospital, versus the other 30% that are practicing, say, in an adult hospital or a system that has, a pediatric program or a pediatric service line, but not a freestanding children's hospital. And then finally, the bottom left, only 1% of physicians in our data set are practicing in groups of less than 75 physicians. This is an important demographic to know when picking up any industry source of data. Nearly half of the ECG data is from groups with more than 1,000 physicians. These are usually large freestanding children's hospitals groups, or they are large multi-hospital systems that have adult and critical mass of pediatric subspecialists. 89% of our data is from physicians in groups of at least 250 physicians. So definitely large medical groups are the driver of the ECG data set. And if you review those participant demographics from other large industry surveys that produce benchmark data, you'll find that some don't align with these demographics. There could be a significant proportion of their groups are coming from a very small practice, less than 5 physicians in a group. And the economics of this type of organization are simply different. They're vastly different from that of a group of 500 physicians. And these are important data considerations when evaluating what benchmarks to pull into your market assessments and compensation planning methodologies. Moving along to the next slide, we're going to get into some more macro conversations, and we really can't talk about performance trends over the last couple of years without discussing the impact of the COVID crisis, as well as the changes implemented by CMS to the physician fee schedule. And the forces of COVID began hitting our health systems in early 2020. During this time, markets across the country were under different degrees of forced shutdowns. State and even many times local mandates were variable, even county to county mandates were differing. And then couple that with each organization having a different response to these market pressures really meant that there was no two organizations that shared the exact same experience or outcomes. And even in 2021, as stay-at-home mandates were lifted, patients began going back to in-person care in some capacity. The rate at which medical groups and different health systems experienced a rebound in those volumes remained and remains highly variable, and we'll see that in the data. And as we will see in those upcoming slides, the impact of COVID-19 is still being felt in our 2022 data from the 2023 survey. The other piece of this is that in January 2021 brought implementation of the most significant changes to the physician fee schedule that we've seen in well over a decade. And this fundamental shift in how E&M activity was valued continues to have lasting impacts on organizations, particularly those that use RVUs to calculate some portion of their physician or APP earnings in their planning, in their compensation plans. So, and then post-COVID market pressures such as the labor shortage of clinical support staff, of our provider staff, and then provider recruitment and retention challenges have made the need for accurate and reliable data all the more acute in the pediatric space. And ECG is a firm that prides itself on meeting those data needs for our clients and other customers of our data. On slide 24, all of that kind of setup really begs the question, what's ECG done to help and to address these major market disruptors in our survey? And data is a very powerful thing. Our goal is to provide our members with up-to-date, actionable data that can facilitate, support decision-making and analytics. We have published supplemental benchmarks for 2 years now that account for these RVU changes. In the 2023 survey, all of our members have access to 3 unique sets of benchmarks. So in the bottom left, we publish RVU and RVU ratios under the old 2020 physician fee schedule. And this takes the 2022 activity that we collected in the 2023 survey and applies the 2020 physician fee schedule to that activity. In the top left box, we also publish what's called our standard benchmarks, and that is our 2022 physician fee schedule applied to the 2022 activity that we've collected at the CPT code level. And then finally, the box in the top right, we use the 2022 CPT activity and we calculate benchmarks under 2023. And we do that so that we can examine, analyze, report on any differences that we will be seeing, that we anticipate seeing between the 2022 and 2023 survey going forward. And in addition to detailed RVU and RVU ratio benchmarks under various years of the physician fee schedule, we'll also publish data on 20 additional metrics of compensation and production. So things like clinical and total cash compensation, various components of value-based compensation, such as quality, patient satisfaction. We also report production-based compensation, collections, benefit data, panel size, E&M visits. There's a lot of information contained there at your fingertips. Moving along to some core compensation and production trends, these are the key takeaways with respect to compensation, work RVUs, compensation per work RVU, and net professional collections. And during this session last year, we came to you with a story where we saw both compensation and work RVU increases from the 2021 to 2022 survey, indicating that recovery from the COVID year had begun at some level, but production was significantly lagging behind those pre-COVID numbers where we were. And this year, it's a similar story. Compensation did increase by 6.7%. On slide 25, you can see this both in a data table as well as a graph. So this year compensation, I forgot to make time for our polling question. So I'm going to pause before I get too far into the rest of the presentation, and we're going to go back to our polling question with Alan around different MPFS schedules.
Thank you, Angie. You should be able to see the polling question appearing in your screen and reads, which year of the physician fee schedule are you currently using to calculate RVUs for your providers? Please select 1, 2020 or earlier, 2021 or 2022, 2023, not sure, or we do not use RVUs in our compensation plan. So go ahead and begin submitting your answer. One thing that I will say as you are beginning to do this is that this question will provide insight into how your peers are considering this important question. We certainly have detailed analysis, as Angie has already gone through, but I think it will be instructive to you to see what others are thinking, at least those that are involved in this webinar. The other thing that I think will be interesting, and let me just comment from the ECG perspective as well, and that is we find value in seeing what happens when these groups come together, when you come together as leaders within your departments and begin to share information. Okay, I see that we have got great responses. So here's what we have. 27% are using 2020 or earlier, 9% 2021 or 2022, 50% 2023, 9% not sure, and 5% we do not use RVUs in our compensation plan. Thank you for participating. Angie, what are your thoughts about this?
Well, I think this is the second year where we've done this survey, and we've also done this more broadly across our clients in a rapid survey. And this actually does, these results do kind of show a marked trend towards migrating away from the 2020 survey. Those numbers used to be flipped, right? So what we found out, 9 months ago to a year ago, when we did this at the beginning of actually 2023, is that we had 40 to 50% of our clients were still on the 2020 or earlier fee schedules, and now you have 9% that have moved to 2021 or 2, and then 23%, so almost 60% have moved away from the quote unquote old fee schedule and onto something more recent. So I do think that is a definite kind of movement in the market to the more current, the current fee schedule. Well, thank you, everyone. We do actually find those data points very valuable, and especially when we see market movement, that's really helpful in our client work as well. Sort of recasting what I was so excited to share with you all here, but I forgot about the polling question. But what we were speaking to here is that, we did see compensation increases last year, and we're seeing it in this year's survey data as well. We saw in the table on the right, in the first column there, that compensation increased by 6.7% over last year. When we compare where we were at this year to the 2020 survey data, so that's the last pre-COVID data set we have, we see in the second column there that compensation is increased by nearly 10%. When we look at just last year to this year for work RVUs increased by almost 8%. And that was similar last year. We had seen from 2021 to 2022 an increase in RVUs. However, when you kind of pause and say, well, how does that compare to where we were at before the world changed on us? We are still lagging significantly behind those 2020 numbers. Work RVUs remain significantly under by a significant proportion, by 13.6%. Of course, that is better than what we reported last year, but there is still, a lot of variability, and indicating that just the pediatric population does have a ways to go before volumes even begin to approach those levels that we saw pre-COVID. And we did further examine that work RVU variance by looking at volumes in our CPT code data set, and it does align with lower RVUs as well, meaning that we did see those 10, 15, sometimes 20% variances in the visit volume when we compared the 2023 results to pre-COVID data. So those volume differences are real, and we'll continue to sort of track that, from year over year, both at the macro level as well as at the specialty level. I think one of the important takeaways is that, only a couple of years out of the COVID impacted year, these benchmarks from 2022 and now 2023 really may have defined a new normal and a new baseline for compensation and production. And really understanding the impact that has on your organization's operations, economics, financial stability is critically important. It's probably unlikely that we see those volumes and RVU levels rise to their pre-COVID levels, even in the near term. For certain specialties, you may see that get back to pre-COVID, maybe in some of the primary care areas. But we are expecting that these baselines are kind of reset in terms of RVUs. And we can see some of the specialty variability on slide 26, giving you a more detailed look at how the medians have varied using the different years of the physician fee schedule. And the top table shows the variance in medians by specialty under the 2022 physician fee schedule and the 2023 and 2022 survey years. So overall, work RVUs went up when we controlled for the physician fee schedule from 2022 to 2023, as did compensation. However, that bottom row there in that top table shows compensation per work RVU for hospital-based, medical, surgical, all went down as a result of work RVU production really outpacing earnings year over year. Pediatric primary care compensation was a little bit different, or primary care comp per work RVU was a little bit different. It actually increased as we saw compensation gains outpacing the gains in work RVUs that were made. In the bottom table, this is looking at a more detailed analysis comparing 2023 to those pre-COVID numbers from the 2020 survey. And we do see that across all specialties, work RVU production, again, remains well below where we were reporting. We saw that in a macro level, but that plays out when we look at this by specialty category as well. And even though compensation has increased in that time, work RVUs have not, and that really results in large increases in the rates of compensation per work RVU when you compare our 2023 data to the 2020 survey data. And then for groups that have not done this type of exercise on their own CPT activity, we are able to do that for you, on a complimentary basis and give you some perspective as well. And there really could be some material unintended consequences if compensation rates are not aligned or adjusted to align with the physician fee schedule that your organization is using. You may all be wondering how the 2024 preliminary data is shaping up. On the next slide, the physician fee schedule. And while we're still waiting for that final rule to be published for the 2024 fee schedule, we can analyze the preliminary data that's been released. And other than the introduction, or I should say the reintroduction of the add-on code, the G2211 code for complex care patients, other changes to the Medicare physician fee schedule are expected to be immaterial in terms of its impact on RVUs. But the G2211 is the add-on code that is identified for recognizing the additional resources required to care for chronically ill, medically complex patients. And this add-on code applies to outpatient E&M codes, where when fully adopted by an organization, CMS is anticipating it will be billed with 54% of all outpatient E&M codes. And while organizations are educating themselves on this code and the impact, CMS is predicting that in like a partial implementation, that the ramp up, that this add-on code could be applied to around 38% of all E&M codes. So we've been able to build those models to work through, what if we had 38% of all of our outpatient E&M codes, got this add-on code, and then what about when we had full implementation, where we would estimate 54% of all of our outpatient E&M codes would have this additional code applied with RVUs associated with it. And so the summary table here on the bottom of the slide presents the analysis to compare the 2023 survey medians to the projected 2024 medians under those three scenarios. So no adjustment for this add-on code, the partial adoption adjustment of the 38%, and then the full adoption adjustment, which is the 54% of all E&M code volume. And so overall, if you look under that full adoption, work RVUs are projected to increase overall by about 3.5% compared to the same CPT activity under the 2023 physician fee schedule. We do see the largest increases, and it makes sense, in primary care and medicine, followed by surgery. Without any adjustment to or for this G2211 add-on code, work RVU are really projected to be flat. It's at a negative 0.02%. So, immaterial in terms of looking at the impact across different types of specialties. Moving along to slide 28. We do also collect survey at the organization level from our survey participants, and this really helps inform some physician compensation planning trends, different comp structures, and we do continue to see a majority of physicians and organizations that are paying their physicians under some type of a variable plan in a base plus salary incentive plan, and that incentive remains driven by work RVUs. It's still a significant proportion of the incentive that's offered at most of the organizations, the vast majority of organizations that are part of the survey. About 3/4 of the physicians of the organizations say they use work RVUs in compensation plans for hospital-based physicians. And I think the reason that's different is points to some of the differences in hospital-based coverage specialties that Stuart addressed at the beginning of the presentation. We still are seeing increased numbers or proportions of organizations that are incorporating quality metrics. Almost 3/4 of all organizations are incorporating quality metrics, and we have most of our organizations, a little over half, most of the time, have a form of patient satisfaction included in their incentive plans as well. Slide 29, we've just provided some of the dollars associated with those value-based compensation metrics. Pediatric surgeons have the highest median compensation among all those specialty categories. The median for them is reported at just under $20,000, and that represents a typical 3% of compensation. The median quality for primary care is a little over $18,000, 6.2% of compensation. Medicine is a little over $10,000. Hospital-based specialties, those physicians are earning typically around $15,000 for quality dollars, incentive dollars. We also have the ability to report patient satisfaction, and we have that for primary care specialists this year. So the typical payment for a primary care physician for for patient satisfaction compensation was a little over $5,000, and that represented about 1.7% of their total earnings. Moving along to the next slide. We do have here just a highlight of some APP data. We could do a whole entire other webinar on the wealth of data we have on APPs, and in fact, I think we're actually doing that in a couple of months. But in addition to compensation and production data, the ECG survey contains detailed information on APP compensation plan structures, the metrics used in those plans, similar to what we just talked through with physicians. We also collect data on whether these types of NPs and PAs in different pockets of primary care, urgent care, surgery, whether they take call, how they're paid for call, as well as recruitment and hiring packages for these providers. So just a full suite of information around APPs, how they're employed, as well as some data trends. But for now, kind of in the interest of time, this slide details out some of our key findings around compensation. Last year, APPs also saw an increase in comp, and this year we're seeing another increase of 5.3% from 2022 to 2023 for our NPs and PAs. Our psychologists were experiencing a large percentage increase of almost 12%. I think that probably has some relationship to the mental health crisis and how those providers are being utilized within medical groups, and may also point to some shortages within the psychiatry specialty as well. We also report median compensation levels for NPs and PAs at the specialty specific level, and a snippet of that information is presented in the bar chart on the right. Some of the highest paid NPs and PAs are in neonatology, orthopedic surgery, and actually general pediatrics popped as a top paid specialty for NPs and PAs this year. You know, we do have this specialty specific data for 26 pediatric NP and PA specialties. The last data intensive slide here just gives us an overview of what's going on with benefit packages. And these are benefit packages that are employer paid benefit packages. So these are including things such as the cost of health benefits, life insurance, disability, the retirement plan contributions that employers are making to provider retirement plans, any professional licenses, board certification fees, some of your federally mandated payroll taxes, for example, are in this total benefit number. So the 2023 average benefit expense per physician FTE was really pretty stable at a little over $47,000. However, the ratio of benefits to total compensation decreased, really driven by the increase in earnings that we saw on stable benefit numbers. When we jump over and look at the APP side, the average benefit expense for pediatric APPs decreased slightly, but is a number that is in line with, you know, the past several years, around $28,500, and that represents 22.8% of compensation. And you can find those detailed specialty specific benefits, including a separate carve out just for retirement benefits on ECG Vault as well. The last section here is just in the slide deck for your benefit, but on slide 34, we've just outlined some of the member benefits that come along with the partnership that you all have with us when you contribute data to our surveys. Not only are you part of the largest pediatric data set in the market, but you also have the opportunity to interface with our team and get some custom market reports. So we will provide some custom physician and APP market reports that compare your data to the national data set. You know, additional optional components can also be included in that as well if we have a conversation and understand what you need. We're happy to provide some education sessions around any regulatory and federal updates, as well as, you know, updates on compensation trends and hot topics like this. So we encourage all of you, if you are not yet a member of the survey, to go ahead and reach out to us or figure out how we maximize your membership. If you've maybe submitted just comp and production, maybe you or comp and FTE, and maybe it's time to start having a conversation about submitting CPT data to us. It just opens up a wealth of opportunity to talk to you and to help work through some of those challenges related to production and services and things of that nature. So with that, I will conclude my comments, and I will turn it back over to Alan to wrap up our presentation today.
Angie and Stuart, that was absolutely fascinating. And as you see, we have come right up to the hour, so we won't be taking questions. But let me just say this. We are so appreciative of each of you attending. You know that we have an extensive library of thought leadership in addition to compensation. Let me just give you the email address, the web address, apologies. If you do want to query that, and that's www.ecgnc.com, and that will allow you to learn more about these relevant and timely topics in addition to compensation. I would like to again thank all of you for attending today's presentation. One final reminder, we would greatly appreciate your taking a moment to complete the electronic survey upon exiting today's program. As stated earlier, ECG will make a $5 donation to Doctors Without Borders for each survey submitted. Thank you to everyone. Have a great day.